Good morning, beautiful people. That was weird. Good morning, beautiful people. Or good night if you're watching this at night. I hope you are all doing well, and I hope you guys are entertaining yourselves thoroughly, however you choose to do so. For those of you who don't know, I am currently working as a pediatric nurse in a private practice. It's a primary care office. And I'm also working on getting my doctorate to become a nurse practitioner. If you don't know what that is, you can Google it, or I'll tell you later. My spring semester just ended, so I've been pretty bored. My summer session starts in about 2 weeks. So for the next 2 weeks, I'll be just kicking it, laying back, chilling, excuse me, just working. Today, I will be bringing you a story about my life as an outpatient pediatric nurse during this pandemic. If you think this is going to be super boring, hurt my feelings, whatever, I don't blame you. You can fast forward, just skip to the part where I cut my husband's hair. I work at a small private practice with one physician. Imagine the office that your parents dragged you to when you were a little child and you were screaming in the car because you didn't want to get your shots, or you pretended like you were well enough to go to school because you didn't want to go to the doctor. That's the place I work at. Lately, during this pandemic, I imagined it would be a lot crazier actually. No, we don't have PPE. I mean, who has PPE these days? We have regular surgical masks and we have gloves, which no, will not protect me from a patient who has COVID. We will use hand sanitizer before and after all patient contact. We sanitize and wipe down all the patient beds in between each patient. My manager is super clean. She was super clean before, and now she's even more clean. So imagine how immaculate our office looks. I can literally eat off the floors. We are still seeing patients, strongly recommending that the kids under 2 years old are coming in for their vaccines because there are a billion vaccines to get in such a short amount of time. Those poor babies. It's for their own good. We do strongly recommend that parents traverse through the earths to get to these appointments so that their kids can be protected from all the other diseases out there. Other than that, if we have older patients, we're okay with kind of pushing their appointments a little bit towards end of summer. As for the sick kids, we still see the ones that sound like they're not COVID positive. So we'll still see the diarrhea kids, the rash kids, the kids who fell down the stairs, the kids who have toe pain. Yeah, we still see those. And as for the kids who sound like they might have a risk of having COVID-19, we'll have to send them out elsewhere because we don't have the proper PPE to stay safe. We also don't have testing kits, so lose-lose for everyone. Only scary thing is some kids are showing to have very vague symptoms. It might look like any other cold out there. So if they come into our office thinking that it's a regular cold, or maybe they want a strep test, or maybe they think it's allergies, they could be exposing us and everyone else in our practice to COVID. So that's where it gets a little tricky. So that's the only reason I'm a little worried during this season. I have been reading more recently that some kids are having pretty severe symptoms and they are being hospitalized and they are being admitted to the ICUs. And interestingly enough, some of them have also been found to have symptoms associated with Kawasaki disease, which is pretty bad. So our state is supposed to start opening up slowly this month, and that's when I think things could go really south, because people are going to be taking less precautions because they think they're in the clear. More people are going to be going out, doing things, trying to be normal again. We'll see how that goes. I am worried. Yeah, we'll see. So that's really all I have to say about that at this point. I know many of you are getting really antsy. I know you really want to meet people and socialize and eat at restaurants and meet for coffee, and I'm right there with you. I am dying to do all of those things. But please follow social distancing guidelines. Take the necessary safety precautions. Just because you wear a mask and gloves doesn't mean that you're protected, especially those of you who are wearing gloves and then using your phone and then driving. And why? I don't understand that. But anyways, yeah, just be smart. Protect yourself, protect your family, protect people around you. Have a heart, people. On a lighter note, I did cut my husband's hair this past week, and I think it looks pretty good. So keep watching to find out what that looks like. And also stay tuned for the joke of the day. Bye. I wanted to introduce you guys to Mike's high school haircut. It's very sexy.
What kind of hair is it?
Dragon Ball Z. Like seriously, I'm getting flashbacks to your high school pictures.
That's so funny. god, the sun. Oh, you're pale as butt. You're so pale right now. Ew, you did that on camera?
I thought you were done.
No, you're
Edit.
like pale as crap, so I'm trying to like get good lighting.
But we encourage you
This is Mike's haircut from yesterday.
focus on one. So make sure
If it looks weird, it's his head shape, not my
Wow.
cutting.
지금 뭐가 되는 거야?
찬열 씨, 우리 이혼해요.
뭐라고?
Was it good?
Are you Korean now because you're watching dramas?
Was it good?
No.
Dang it.
Babe,
Hmm?
what's the difference between the bird flu and the swine flu?
I don't know.
One requires a treatment and the other an ointment.